Name's Annalisa Peterson. I'm an OBGYN here in the Baltimore area.
And I am Dr. Janeeka Benoit, also known as Dr. J. I'm a board-certified internal medicine physician and subspecializing in sports medicine.
And so we're here today just wanting to discuss exercise and pregnancy and shed some light on how this is something that's very beneficial for all pregnant women. You know, in our society, it seems as if exercise and doing kind of any strenuous work during pregnancy is not all that acceptable. And there's probably a lot of reasons for this. I think people think that exercise can lead to miscarriage or may cause the baby to not grow as well. But, you know, through research, we've learned that exercise is actually very beneficial for women who have uncomplicated pregnancies. So exercise has been shown to reduce gestational diabetes. It reduces the risk of cesarean delivery, and it even helps with recovery after delivery. So Dr. J, you are the exercise expert. Can you tell us how you got interested in sports medicine and specifically exercise as medicine?
Yes. So like I stated, I'm a board certified internal medicine physician. And during internal medicine residency, I was growing frustrated with having to just continually prescribe medications to my patients to maintain their health. I really wanted to be on the other side. I wanted to help my patients find health instead of simply maintain their health with medications. Patients would come to me with shopping bags full of medicines, and they didn't know the names of their medicines. I was growing frustrated that they were taking so many medications, and I thought to myself, what if there's a way that I can teach my patients to exercise so they can decrease their pill burden? And myself, I was a personal trainer prior to going into medical school, and I just most of my life been an exercise enthusiast. So I decided to merge those two passions, medicine and exercise, to make this a mission of mine to help my patients use exercise as medicine instead of simply relying on their medications to maintain their health.
Great. And that's something that so many people are looking into today because most people want to get off of medications. Most people want to prevent disease rather than treat disease. So I think you definitely have a great population of people who are interested in what you're doing. But let's kind of get back to the exercise part of it, the pregnancy and exercise part. I wanted to ask you, so just for a woman who is pregnant, she's wanting to stay fit during her pregnancy, what would you suggest she do to prepare for exercise? And then what type of environmental conditions would be best for her during her pregnancy and exercising in pregnancy?
Yeah, so I think first and foremost, it is, and this may be difficult at first, but the most important thing is to make sure that you have a physical active lifestyle prior to becoming pregnant. It's important that this type of lifestyle is adopted as early as possible, because that way you can prevent risk factors that can lead to complications in pregnancy, such as high blood pressure and diabetes. The next thing is to make sure that you don't have a medical reason that would prevent you from exercising, such as heart disease or restrictive lung disease. Once that's out of the way, if you're medically cleared, the next thing is to assess, is to have your physical activity levels assessed. Now, if you were sedentary prior to becoming pregnant, then you can start such as a walking program to start becoming physically active. Now, if you're already physically active prior to becoming pregnant, you can resume your activities that you were doing prior to becoming pregnant. However, because when you're pregnant, pregnant women have something called the higher basal metabolic rate. So you're expending more energy already by having to maintain the growth of a baby that's inside of you. So, for example, your heart is pumping more blood in order to maintain the growth of your baby. And because of that reason, you're going to be increasing more energy. And with any especially high intensity exercises that can improve your temperature, because you're already increasing energy already and producing higher levels of temperature, high intensity exercise is only going to increase it. So it's important that you minimize the intensity of your exercises while pregnant.
Okay. And so, can you give some suggestions for aerobic exercises and weight bearing exercises? I know that you mentioned walking earlier, but what would you recommend for a pregnant woman?
Sure, yes. So walking is a great one. You can also do a stationary bike. Water aerobics is also a great one, great aerobic exercises, even dancing. So those are great aerobic exercises. In terms of weight-bearing exercises, resistance bands is a great exercise. Also weights as well. Now, I wanted to also mention that the point of the weight-bearing exercise is not to improve strength, it's to maintain strength, because there are changes that occur during pregnancy. One of the two distinct changes that occur is weight gain, as you know, and your point of gravity changes because all your weight is being shifted to the front. And what happens is that can lead to increased curvature of your spine, and that can lead to back pain. So with back pain, it's important to make sure that your back muscles and your abdominal muscles are well strengthened, so that you can avoid things like back pain during pregnancy, which is a very common symptom that many pregnant women experience.
Yeah. And I like that you mentioned the resistance band, because that's something that people can do at home. It's fairly inexpensive. And then there are lots of like YouTube videos or books and things you can use to kind of learn different exercises just with the resistance band.
Oh, for sure. And I love them because, you could even, if you're on vacation, you could put them on your suitcase. There is no excuses. You could still do your weight-bearing exercises. You're on vacation.
Right, right. Yeah, it's definitely very mobile.
Yes.
So now just kind of getting into your sports medicine side, what are some signs that maybe an injury has occurred during exercise, and what should a woman do if she suspects she's injured?
Yeah, so this is a really good question, because during pregnancy, there are many changes. So another change that occurs is that you produce a hormone called relaxin, and relaxin is just in the name implies is that it relaxes your ligaments. And with relaxation of your ligaments, you can be predisposed to strains and sprains. And that can lead to musculoskeletal injuries. So now, although the data does not support a robust increased incidence of musculoskeletal injuries that occur in pregnant women, it's still important to know that it is a possibility of happening, especially in the setting of exercise. So if you see any swelling of a joint, for example, your wrist or your knee or your ankle, it's important to stop exercising and then get it evaluated, just to make sure that you're not doing any further damage at that point.
And that's really good to know, because number one, for pregnant women, we don't want you to fall. So if you think you've injured your knee or something, your ankle, then you really do need to stop. You want to reduce, using that limb until you get it evaluated, because if you keep going and it gets worse and then you end up falling and hitting your belly, now you've created two problems. So it's good to know these things to prevent injury, or just to kind of get things evaluated before you continue your program.
Definitely. Now I'm going to be asking Dr. Peterson some questions. All right. So first question, Dr. Peterson, I know that exercise is overall beneficial for all women, but are there some pregnant women who should not exercise?
Yes, and that's a good question. And actually, you kind of went over a couple of these earlier when you were talking. But one of the first things is, if you have any significant heart disease, you should not be exercising. Restrictive lung disease. So examples of that include things like pulmonary fibrosis or sarcoidosis. There's also something called incompetent cervix. So if you have that, if you're a pregnant woman and you have that, you know what it is. Your doctor has diagnosed that for you probably early in the second trimester. So if you have an incompetent cervix or you have a cerclage in place, you should not be exercising. Other conditions such as persistent bleeding, especially if that has carried on into the second and third trimester, we recommend that those women don't exercise. If you've been diagnosed with placenta previa and that has persisted beyond 26 weeks of pregnancy, again, you need to kind of avoid exercise and follow your doctor's instructions. Other things like if you've had issues with premature labor during this current pregnancy, or maybe even your water broke weeks before your due date, you should not be exercising. And then finally, preeclampsia or high blood pressure in pregnancy, we recommend that you don't exercise, and also if you have severe anemia. But to be on the safe side, I would recommend that every pregnant woman talk to her doctor about exercise before you begin any exercise program. Make sure that you review with your doctor the type of exercise that you are looking into. For example, we wouldn't really recommend things like horseback riding or maybe playing soccer. So those things could cause injury to the baby. So we do recommend that you avoid those types of exercises.
Awesome. Thank you so much. Now, the next question, what about walking or doing squats around your due date? Does that really help bring on labor? We want to know.
Yes. So that is a common thing. A lot of women, they're at the end of the pregnancy, they're tired of being pregnant, they'll do anything for labor to start. So there's really no evidence that shows that doing squats or doing a lot of walking will bring on labor. I mean, if that was the case, we wouldn't have anyone going past their due date. We wouldn't have to induce women to go into labor. So these things don't actually help bring on labor, but it's certainly they're certainly considered to be safe in pregnancy. So as long as your doctor hasn't told you to not do those things, it's definitely okay to walk, to dance, to do squats, whatever feels comfortable during that third trimester, but it does not bring on labor.
Yes, thank you so much, Dr. Peterson, for that, because there's a lot of misinformation that gets disseminated out in media. So thank you for discussing and clarifying that.
No problem. Thank you. Thank you for having me. And, just shedding some light on some of those exercises that women can do during their pregnancy.
Yes, for sure. So this has been a great conversation. To end it, how can we find you, Dr. Peterson?
So I actually have a YouTube channel. It's under my name, Annaletta Peterson, MD. So if you go to YouTube and find my channel, you'll find more videos on pregnancy and women's health. And how about you, Dr. J? How can people find you?
Yes, so I have a YouTube channel as well. People can find me underneath MedFitDO, that's MEDFITDO. And I am also on Instagram at the same name as well.
Awesome.
Awesome. Well, I hope you guys found this helpful. Make sure you subscribe to our channels and follow us. See you soon.
Bye.
Bye.